Hi guys, my name is Alina Starobinsky and today is June 14, 2019. This is Pathophysiology and this is week 2. This is my first video. So today I'm going to be talking about the disease, the meaning of the disease. What does it mean? Disease is a particularly abnormal condition that negatively affects the structure or function of organ or organism of your body. Example of this would be peripheral vascular disease. Peripheral vascular disease is a disease of your peripheral arteries and veins, so the vessels outside of your heart. Basically what happens with them that they become narrow, they spasm, they get calcific, and you don't get a proper circulation into your toes, into your legs, and people usually suffer with leg pains and cramps at night. The pain usually comes on from exercise or walking, and it's due to lack of oxygen into your tissues, so into your muscles. So that's an example of the disease. The second is disease classification. What is the classification means? It's actually just subdivision of different type of categories of the diseases. It could be abdominal disease, or it could be a vascular disease, gastrointestinal disease, cardiac disease. It's just classifications of different types of disease. Next, I'm going to be talking about etiology. So what is etiology? Etiology is the study of the causes and origin of the disease. There could be many different factors where the disease came from. I'll give you an example. What about vitamin D deficiency? Vitamin D deficiency is a lack of exposure to the sun or improper nutrition. Usually can be detected by simple blood test, and the physician can prescribe supplement, and the patient will feel much better afterwards. Usually the first signs and symptoms of vitamin D deficiency is pain in their muscles and cramps, and that could lead to other different problems like osteoporosis, muscle weakness, pain, and other problems. So etiology is actually a study of causes and origins of the disease. Pathogenesis. What is a pathogenesis? The word itself means patho is disease, and genesis is creation. So beginning of the disease. How did disease start? So pathogenesis, it could be a microbial infection or microbial infection. I'm sorry. It could be bacterial infection. It could be viral infection. Also, it could be some kind of disease that arise from dysfunctional immune system. So pathogenesis is the beginning of the disease. That's what it means. Symptoms. Symptoms can be described as objective or subjective. So I can give you two examples. It could be, so let's say somebody feels tired. You cannot measure the tiredness. So tiredness would be subjective, something that you cannot measure. And let's say someone's having a fever. Fever you can measure, so a fever would be objective. Next, the signs. It's a condition, like what kind of signs? It's a sign that you see. It's a visible things that you can see as signs. It could be swelling, it could be redness, it could be inflammation of the skin, infection, signs that something that you can see that's happening. Syndrome. Syndrome is a set of signs and symptoms together that represents the process of the disease. Let's say somebody's experiencing irritable bowel syndrome. So when somebody's experiencing irritable syndrome, they have a couple of symptoms. They have abdominal pain, or they have bloatness or a gas in their stomach. They might experience diarrhea. So these are just like a combination of different signs and symptoms, and that would be a syndrome. Next, diagnosis. So what is a diagnosis? Diagnosis could be done by basically what diagnosis means is identification of the disease. And it could be done by getting a simple blood test. It could be done by having diagnose somebody. You can have imaging test done, or any kind of test that you can perform, and then putting all the diagnosis together, putting all the tests together, you can diagnose somebody with some kind of disease or illness. So that's diagnosis. Complications is usually something that happened in the process of something. Let's say somebody come in for a surgery, and during the surgery for a carotid endarterectomy, and um, during the surgery, the plaque just a small piece of plaque just went off into internal carotid artery and caused the patient having a stroke. So instead of procedure going well, something happened in the middle of it, and it um, caused something else to happen. So the patient suffered a stroke, and then out of the stroke, it could be also he could go into a coma. Sometimes out of the complications, the patient could survive and everything could be okay. But sometimes complications just can turn to the worst. So that's that. And prognosis. A prognosis usually is the outcome after it's a recovery. So let's say somebody had some kind of something, they had cancer, they had several treatments, they had some kind of procedures done on them, and after several treatments and after a specific procedure, he was cured. So that's prognosis, the how patient recovery after the treatment. So that's that. And then diagnostic media. Diagnostic media is something that we use for, let's say, swab culture, let's say pap smear, or to identify the strep throat. So diagnostic media is something that we use to recognize the microbial infection or any other medical specimen to recognize what it is. So we use diagnostic media for that. Thank you so much. I did it really quick. I hope you enjoyed this video. My name is Alina Starobinski. Thank you.